Ascaris Lumbricoides. Common name of the Ascaris Lumbricoides is the roundworm. Geographical distribution, it is mainly cosmopolitan in distribution. It is seen in worldwide. Mainly it is seen in China, India, Southern East Asia. The habitat, mainly it is seen in the small intestine. In the small intestine, mainly it is seen in the jejunum. 85% jejunum it is seen and 50% in the ileum it is seen. Morphology of the ascaris is about. It is the largest intestinal nematode. It will parasite the human intestine. The worm is fresh and it is light brown or pink in color. Sometimes it will appear like white in color. It is rounded and it has tapers at both ends. Anterior end is thinner. Mouth is present in the anterior. In the anterior side, it has three finely toothed lips and the GAT and reproductive organ. It will float inside the body cavity. It contains irritating fluid. This irritant action it is mainly due to the ascarin or ascarias. The lifespan is less than about 1 year. Morphology of male worm is about 15 to 20 centimeter in length. It is 3 to 4 millimeter in diameter. The male worm, the tail end is curved ventrally and it will forms a hook. The female worm is longer than the male. It measures about 25 to 40 centimeter length. In female worm, the posterior end is curved or pointed and it has a vulvar waist, which means a groove is seen in the vulvar opening, that is known as the vulvar waist. In this picture, we can see the vulvar waist. And the female worm, it will liberate about 2 lakh eggs per day. Totally, it has two types of eggs the worm will produce. One is fertilized egg and another one is the unfertilized egg. The fertilized egg is which is round or oval in shape. It is brownish in color. The fertilized egg is surrounded by thick, smooth, translucent shell. In the outer, it has an albuminous layer. The fertilized egg is clear and it has an unsegmented ovum. Fertilized egg will float in solution of common salt. Unfertilized egg is narrow and it is longer and it is more elliptical in shape. Unfertilized egg is brownish in color and it has a thinner shell with irregular coating of albumin and it has a small stringate ovum and it will not float in salt solution. Next one is the life cycle of Ascaris lumbricoides. In Ascaris, only one host is present. There is no intermediate host and the definitive host is man. The transmission mainly it will occur by the egg containing infective rhabditiform larvae is swallowed and mainly in children the infection will occur by mainly the children will play in the mud. From there the egg will transmit to their mouth through dirty fingers. Sometimes airborne spread is seen. Next one is the life cycle of Ascaris lumbricoides. Usually the development is seen in the soil. Usually the fertilized egg is passed in the fecus. At the first time, it is not infective immediately. For the period of incubation, it need to undergo a incubation period to get an infection. It will take about 10 to 14 days for development. During that time, the embryo will mold twice and it will become the infective rhabditiform larvae that will coil up the egg. Like this way, it will be infective. The development is seen in man when the swallowed eggs will reach the duodenum. In the duodenum, the larvae will catch out. The larvae is actively motile. In the duodenum, it will penetrate into the intestinal mucosa. From the intestinal mucosa, the larvae will enter into the portal vessels and it will be carried to the liver. From the liver, it will pass through the hepatic vein, inferior vena cava, and right side of the heart within the 4 days. From there, it will reach the lungs and it will grow on moltes. After development is seen in the lungs, then it will enter into lung capillaries, and from there, it will reach the alveoli. From there, the larvae will crawl up into the upper respiratory passage to the throat, and it is swallowed. From there, the larvae will molt and develop into adult form in the small intestine. It will take about 6 to 12 weeks to mature, and the gravid female will start laying eggs. Like this way, the cycle is repeated to spread the infection. The clinical features is produced by larvae and the adult. If the larvae spread is seen, means that mainly the Ascaris pneumonia is seen. Mainly it will affect the lung. It is otherwise known as a low-flush syndrome, in which fever, cough, dyspnea, blooding sputum may contain Ascaris larvae, and urticarial rash and eosinophilia is seen. And mainly the general circulation is affected. If it reaches beyond the pulmonary capillaries, means it will affect the heart and the kidney. Next one is the adult. The incubation period is about 16 to 75 days. Mainly the infection is seen in the GIT. In larvae, the infection is seen in the lungs, and in the adult worm, the infection is seen in the GIT, in which the spoliative action is seen when the worm number is more than 500. In small children, the spoliative action is seen. Mainly, it will lead to protein energy malnutrition, vitamin A deficiency is seen, and the patient will have loss of appetite. Mainly, it will affect the small children. Next one is the toxic action. When the body fluid of Ascaris is absorbed, it will produce symptoms such as typhoid-like fever. Some rash-like appearance will be seen, edema of the face, conjunctivitis, and irritation of upper respiratory tract is seen in toxic action. Mainly, it is occurred by the worm will it is occurred by contact with worm. Occupationally, mainly it is seen in the laboratory technicians. Next one is the mechanical effects. Mainly it is seen in the mostly the worm will appear like a moss-like appearance. It will cause blockage in the human intestine that will lead to intussusception. From there, it will penetrate the ulcers of GIT. This mosses of the worm will cause an intestinal obstruction. Next one is the ectopic ascariasis. It is otherwise known as wanderlust. Mainly, the ascarias will migrate to the other place, and it will cause an other place. It will cause an inflammation such as pancreatitis, acute biliary obstruction. Sometimes it will cause inflammation in the appendix region. Mainly, it will cause obstructive jaundice, and in liver, it is seen abscess is seen. Next one is the laboratory diagnosis of Ascaris lumbricoides. Mostly the X is seen in the fecus. The larvae is found out by early stage of infection. Migrating larvae, mostly in the early stage, it will cause low-flush syndrome. It is diagnosed by the sputum. The adult form is seen in the stool or sputum. Mainly, it is diagnosed by X-ray and USG. Serodiagnosis is done to find out the antibodies. ELISA and immunofluorescent assay is done, and blood examination such as eosinophilia is done. Next one is the treatment. Partial intestinal obstruction should be managed with nasogastric suction. Complete obstruction should needed surgical intervention. Next one is the preventive method for Ascaris lumbricoides. Mainly, it is prevented by fecal contamination of soil, by avoid eating raw vegetables, improvement of personal hygiene, and treatment of infected persons, especially mainly the children. Thank you.